my name is Lily. I am a respiratory therapist, and I'm going to be talking about that today. So, a little bit about me. I graduated from Broken Arrow High School in Oklahoma in 2012. I graduated from Respiratory Care School in 2022. I just got married this last October. That's me and my husband. We have two dogs, a cat, and a leopard gecko. I like to just play video games, build Legos, watch movies, hang out with family and friends in my spare time. I'm a little bit of a nerd. And I have been an RT for about 4 years now. So, with that being said, I want to ask you guys some questions that kind of pertain to the field to see if you guys know the answer. If you don't, it's okay, but just kind of getting you prepared for what we're about to talk about. So, first question, what is the average respiratory rate or breaths per minute in an adult? So 24 to 40, 12 to 20, 18 to 30, or 4 to 10.
We have a C,
Okay.
a B, an A, another B,
Okay. So the answer is B, 12 to 20. So 24 to 40 is a little fast for an adult. Children and babies actually have a faster respiratory rate than adults do. So that would be too fast for an adult. And 4 to 10 is very slow, and you might not be very alive if you're breathing that slowly. So, yeah, the answer is 12 to 20. All right, moving on to the next one. What part of the body are alveoli located in? Lungs, heart, kidneys, or pancreas?
we have an A, a D, couple more guesses.
Okay, answer is A, lungs. The alveoli are tiny little air sacs within the lungs that participate in gas exchange. They're located towards the bottom of the lungs at the end of the bronchioles. There are approximately 480 million in each pair of human lungs. And there is a little picture of what they look like. Okay. What word is used to describe the medical specialty that works with the respiratory system? So we have cardiology, nephrology, pulmonology, or hematology.
Got some C's.
Multiple C's. Okay, you are correct. It is pulmonology. Some people call respiratory therapy pulmonary care, so that's why I wanted to hit on that a little bit because those words can be used interchangeably. Cardiology is the study of the heart, nephrology is the study of the kidneys, and then hematology is the study of the blood or blood disorders. I think we have just a couple more left. Okay, which of the following is a respiratory disease? We have hydrocephalus, GERD, atrial fibrillation, or COPD.
We have a guess of D, another D, A,
It is D, COPD. So COPD stands for chronic obstructive pulmonary disease. It is caused by damage to the lungs that results in inflammation and increased mucus production that limits airflow in and out of the lungs. Smoking is one of the main causes of COPD, and it's responsible for about 9 to 10 out of every 10 cases. There's a lot of other causes like environmental irritants, some type of jobs that can cause it as well, but smoking is going to be the most common one. Hydrocephalus is buildup of fluid on the brain. GERD is also known as acid reflux, and then AFib is an irregular heart rhythm. Okay, and there's a kind of a little picture. So like I talked about alveoli earlier, there's kind of a little picture of the air sacs, normal, healthy, and then kind of them damaged with COPD. Okay, so what is a respiratory therapist? They are medical professionals that are trained to work with patients that are having difficulty breathing and or those that are suffering from various pulmonary diseases. These can be diseases like asthma, COPD, cystic fibrosis, lung cancer, and many more. And then I have my little funny that says respiratory therapy, because if they aren't breathing, they aren't doing much else either. Okay, so just some frequently asked questions that I get about being an RT, and I'll have a part at the end where you guys can ask questions too if I don't touch anything that you want to know about. But where do respiratory therapists work? There's so many different options. You're not limited to one option. And I'll just try and touch a couple of the most common ones. So a hospital is going to be probably the most common. You can also work in a place called an LTAC, which is a long-term acute care, where a lot of patients will go after they're in a hospital to kind of rehab a little bit. And then there's other types of rehab facilities. Then there's outpatient, meaning they're not staying in the hospital, but they're still receiving therapy. So there's pulmonary function testing, rehab, and then DME, which is kind of people that deal with equipment. So like oxygen tanks and like a CPAP for sleep apnea and different things like that. And they work with patients on educating them about that equipment. So how do you become an RT? So you do need to be a high school graduate or have your GED. You would need to get accepted into a respiratory care program. I went through a community college here in Oklahoma, but there's lots of different options all over. And some states have different requirements. But minimally, you would need to have a degree, an associate's degree in respiratory care in order to work, which takes a minimum of 2 years. So the program itself for where I live took 2 years, just the program. But then prior to that, I had to complete about a year of general education requirements in order to get into the program. So overall, it took me about 3 years. Then inside of the program itself, you do have to complete quite a few clinical hours, which just means that you're going to a hospital, going to different places, and basically working without getting paid. But it's to get experience. So you get paid in experience, just not in money. So for my program, I completed about 700 hours in order to graduate. That essentially consisted of in a week going to school about 2 to 3 days a week and then completing 2 days of clinicals. So it ended up being almost like a full-time job between going to clinicals and then actually, being in class and learning. There are some board certification exams that you'll have to pass in order to become an RT. And then depending on the state, you can actually work while you're still in school, which is what I was able to do. So I actually graduated with a year of experience before I even passed my boards. You can get what's called a provisional license, which lets you work while you're in school. You can't do as much as when you graduate, but you still get some experience, which is really cool. So the type of patients that RTs work with, we pretty much work with everybody. So adults, kiddos, babies, we work with all different types of people. This is a question I get a lot, is are RTs the same as a nurse? Not at all. We work with people, yes. But as far as education that we get, it's very different. So RTs get a degree in respiratory care, whereas a nurse would get like a bachelor's of nursing or their LPN, a licensed practical nurse. So it's different education completely. Some nursing programs do take longer than RTs, which is can be the benefit or why some people prefer to do respiratory therapy. We also work with one very specific part of the body, the pulmonary system or the lungs, whereas nurses they learn about all of the body. And then after that, they kind of decide on what specialty they want to do, whereas we already picked our specialty, basically. Is being an RT a physical profession? It does definitely depend on where you work. For me, it very much is. I can do anywhere from 12,000 to 15,000 steps in a day, depending on where I'm working in the hospital. If you like something fast-paced where you're not sitting, it's a great thing for you. I am not a sitting at a desk at a computer person, so I love it. But not for everybody, but for me, I love it. Yeah, you do stay pretty busy, especially this time of year. I'm sure you guys know flu is terrible. Very busy this time of year, but I like it. Does being an RT require a lot of social interaction? Yes. You are going to be interacting with all sorts of different kind of people. You're going to be interacting with patients, educating patients, talking to family members, educating family members. You also have to coordinate with nurses and doctors, especially in a hospital setting, on plans of care for patients and things like that too. So it's good to be a people person. And then one that's a little gross, but I think is important is, do you deal with bodily fluids? And absolutely you do. So if you're someone that is a little bit squeamish or is not sure about blood or sputum or anything like that, might not be the thing for you. I am not bothered by much, so I find it all very fascinating. But yeah, okay, so moving on. Uh, Let me see. I should just be able to click this. So I personally work with adults. I'll kind of get more about that in just a second. But this is a video I found on YouTube that shows a day in a life of somebody who works in a neonatal and pediatric ICU, and I will let you guys watch that. Let's see.
This is a day in my life as a respiratory therapist in the neonatal and pediatric intensive care units at Rush. I start my day by clocking in just before 7. The respiratory therapy team meets for our morning huddle. Then I go to my unit and start patient handoff with last night's respiratory therapist. I walk door to door, getting reports for each of my patients before picking up my pager and phone. Now we're going to spin. It's part of the making hand hygiene. I check on each of my patients' clinical data in Epic and determine if any changes need to be made. As patients' care teams do their rounds, I'll pop in and offer my assessment of how they're doing clinically. With rounds done, I'll take a moment to have a snack and reset. When I get back, I'll check on all my patients and make changes to their ventilators and recalibrate any equipment. It honestly takes a specific kind of person to work in the NICU and PICU. You really have to love children and be very patient with them and their parents. My interest in respiratory therapy was sparked when my grandmother was placed on life support. I was fascinated by the ventilator and had a lot of questions for the respiratory therapist. I wanted to help people get healthy again. I studied respiratory therapy at Rush and started working at Rush right after and got my master's here as well. Today I'm heading over to PICU to check on my other patients. I finish up rounding and assessing patients and making adjustments as necessary. Then I'll head over to lunch. When I return, I'll get back to doing rounds and checking on my patients. Teamwork is one of the reasons why I enjoy working at Rush. The whole medical team gets along well. The respiratory care team is very diverse and is well respected with the broader medical team. We're quick to help each other and hold each other accountable so everyone continuously improves. We've won multiple Apex awards for respiratory therapy, which showcases the excellent care we're always providing patients. Towards the end of my shift, I write progress notes for each patient in Epic. Based on today's patient workload, I will assign roles for the following shifts. Around 7 p.m., I'll start wrapping up for the day and preparing to hand over to our evening respiratory therapist. At 7:23, I'll clock out and start heading back home to get some rest after a long, fulfilling day.
All right. Okay, hold on. Let me get back to.
Hey
Okay.
guys,
I'm Siobhan, a fifth-year medical resident.
Nope. Okay, sorry. Okay, so that was that. That was a pediatric respiratory therapist. So what does my day personally look like? So I, as that girl does, she works 12-hour shifts, and so do I. In a hospital setting, that's pretty normal. So I work 3 12-hour shifts a week, which is considered full-time. I work at Ascension St. John in Tulsa, Oklahoma. I personally only work with adult patients. My hospital does have a neonatal ICU. I don't personally work there. It's a very specialized area that I just have not had training in yet. And working with babies can be a little bit difficult. So it's something I'd like to do eventually, just not something I've done yet. I work in pretty much every area of the hospital. I work on the medical floor, the intensive care unit, step down ICU in the emergency department. So, what does my day look like on a daily basis? And this is a very broad snapshot, but so I assess patients with different pulmonary diseases and those who are in respiratory distress. So a lot of what I do is I get phone calls from nurses or physicians to come look at patients and kind of decide plan of care and what they think that we should do respiratory wise. I monitor vital signs. I monitor, their heart rate, their oxygen level or pulse oximetry and respiratory rate. Administer breathing treatments, do something called chest physiotherapy, which is a physical type of therapy that we use to help clear mucus with patients. I assist physicians with intubating patients, which means you're placing a breathing tube in their airway to help them breathe, and then placing them on a ventilator. Managing a ventilator, which is a type of life support, that's probably, I would say, a good 70 to 80% of what I do. I do all these other things, but in the ICU, that's a lot of what I do. And then also, I am the one that takes the breathing tube out of the patients when they're ready. Sometimes it is in situations where it's so the patient can pass away naturally. I administer various types of oxygen therapy through a nasal cannula, oxygen mask, a BiPAP or CPAP. Some of you might have heard of that if you know somebody who has sleep apnea. It's that mask that they wear at night. I also educate families and patients about all sorts of different topics. Our RTs do, a lot of people don't know this, but we do actually draw blood from patients. It's something called an ABG or an arterial blood gas, where we get patient blood from the patient's artery, usually here in the radial artery, and we draw that blood and then look at the results from that ABG and change the patient's plan of care accordingly. We do something called bagging a patient or ventilating a patient using a bag valve mask during emergency situations like a cardiac arrest. If someone's having a seizure, they're unresponsive, or they're just not breathing at all. And then we collaborate with physicians on plan of care for patients. Typically, that is in an ICU or an ER setting. So I'm a very visual person, so I wanted to have some pictures of kind of what are some different things that we do on a daily basis. So top left-hand corner, you have a gentleman that has a tracheostomy or a trach tube, which is another thing that we deal with very often. So he has a breathing tube in his neck, and the respiratory therapist is there cleaning it, and he's getting oxygen from that tube. The bottom left, it's a dummy patient, but they're putting a BiPAP mask on them to help them breathe. Top right, you've got a kiddo that is getting a breathing treatment, and so is her little teddy bear. And then bottom right is an older patient who is also getting a breathing treatment. Then this next one, we have top left-hand corner is a patient who is intubated or has a breathing tube, and they're attached to a ventilator. Bottom left-hand corner is a pediatric patient who also has a tracheostomy tube in his neck that's breathing for him. The respiratory therapist looks like that she's suctioning his breathing tube, and he's also attached to a ventilator. Top right-hand corner is they're bagging a patient like I was talking about. They're helping them breathe, and they have a breathing tube in. Looks like they probably just intubated the patient or just put the breathing tube in, the fake patient, but you know. And then bottom right-hand corner is them giving some positive pressure to a little baby, which is one thing that a lot of NICU therapists have to do is they go to deliveries for like really premature babies. They have to assist in every single delivery and be there in case the baby comes out not breathing, which can happen a lot. Again, that's not something personally I do, but as a NICU therapist, that's what they do is they have to be there, especially for a twin or multiple baby delivery. The more babies there are, the higher they are at a risk of not coming out like they should. And they usually need a lot of assistance from us at the beginning. And then they end up in the NICU for monitoring for however long they need. So question I get a lot is how I became a respiratory therapist. So like I said earlier, I graduated high school in 2012. I did not know what I wanted to be when I grew up, and it took me a while to figure it out. I decided in 2017 to go to school to be a paramedic, and I was like, yeah, this is going to be really great and be high energy, and it's going to be, you know, fun. And I did enjoy it. But the thing I learned was as a paramedic, you learn a little bit about everything about the body, which for some people, that's great and they love that. But I wasn't huge on only skimming every organ system. I wanted to know a lot about one area. And so that kind of led me to pediatric occupational therapy, which just a quick description, occupational therapy, it's kind of in line with physical therapy. It's a little bit different. It helps people basically do everyday tasks. So like brushing your teeth, getting dressed, everyday tasks that you need help with, like with your motor skills. And what I originally wanted to do was work with kids, and so work with babies when they're very little that have different disorders that need help with their motor skills. I had a very specific, what I thought was a very specific idea, and then that didn't pan out, and I got accepted into a respiratory care program, and I am so glad that I did, because I work with occupational therapists in a hospital setting, and I now know that I don't think that I would have enjoyed it as much as I thought I would. So I'm very glad that I ended up where I am. I got accepted into the respiratory care program in 2020, which, yes, that was during COVID, and that made my education very interesting. So that was when I got accepted into school, and then I started working as a student in 2021. And then here I am now. So if you guys have any questions for me, if you want to put them in the chat, and then Amy, if you want to read them, I
Yeah.
can.
You bet. Guys, I'll be monitoring the chat. If you want to chat, you can also come off mute and just ask your questions out loud. It's whichever you're more comfortable with. But we want to take advantage of Lily's expertise while we have her.
I do have a question actually. Do you guys like get babies? Like, do you help the mom give birth to the baby? Okay.
Yeah.
Because
Yeah.
my aunt is a respiratory therapist. Or whatever you call it.
Yeah. No, we do. Like I said, that's not something personally I do, so I don't have as much information about it. But yes, respiratory therapists are there for not the birth of every single baby, but it's ones that they know that are going to be a high risk. So it's ones usually that are premature, or if they know ahead of time that they are going to be born with different type of abnormalities, they will have an RT there ready to do whatever is needed. And so those RTs have a very specific set of skills because I work with adults. So I work with people who can sometimes tell me what's going on. Though a newborn cannot tell you. They have to be able to look at the baby and all of the different signs, what color they are, how much they're moving, how they're breathing. They have to be able to assess them very quickly and know what they need to do for that baby. So they have a very specific set of skills, and they've got to be able to operate and be kind of calm and composed under very high stress situations. But yes, yeah, no, RTs help with delivering babies, absolutely.
We have a question in the chat, Lily. How long does it take starting from high school to become a respiratory therapist?
So once you graduate high school, like I said, you would need to start college, and you need to complete your general education just to obtain your associate's degree. So any associate's degree, no matter what it's in, requires certain classes. So, like your composition 1, composition 2, your history, math, all of them, all your well-rounded. And every program is a little bit different on what they require. My program required certain classes just to get admitted into the program. And like I said, all those requirements took approximately a year. So then once I completed all of those requirements, then I did that in 2019. And then at the end of 2019 is when I applied to the program. And then in 2020, like March of 20, literally right when COVID hit, is when I got accepted. And then from that point in the fall of 2020 is when I started the program. So really, I completed about 3 semesters of general education before I did the program itself. So like I said, for me, total, it took about 3 years. It might take, some people it takes a little bit longer, just depending on what you've got going on in your life, kids, whatever, family. Some people it took a little bit longer because it just took them longer to complete those general education courses. But once you start the program, the minute you start, 2 years. At least mine was. Hopefully that makes sense. But I know there's some places that there are programs where you can start classes while you're in high school still and complete some college. I know here in Tulsa, there's a program that does that, and there's people, I wasn't able to do it, but there are some people that are able to start some college classes while they're still in high school. So you might be able to do it even faster. It just depends.
Yeah, that was actually one of the questions in the chat is, do you have to wait until college? But it
Yeah,
sounds like if you do concurrent enrollment or other
yeah.
types of prep.
Yeah, for the program itself, yeah, you would have to wait until you're completely graduated, but to do all of the prerequisite requirements for the program, no, you could do that ahead of time. In fact, there was a girl in my class who started the program at 19. And I'm like, you're so young. I was like 26, 27, and it was funny because when we graduated, we all wanted to, go out and have drinks, and she couldn't because she was too young. So yeah, it is very possible that you could do it much sooner. It just took me longer because I didn't know what I wanted to be when I grew up.
How similar is nursing to a respiratory therapist?
They are very similar and very different in so many different ways. So similarities, we both work with patients, are hands-on with patients. I work side by side with nursing all the time. So in a hospital setting, the nurse has that patient, and they're kind of the person that's the main responsibility for taking care of that patient in a 12-hour shift. And then if they have a respiratory specific problem, question, anything, that's where I come in. So they do everything with the body. So head to toe, gastric system, cardiology, everything else. They can do some things that we do, but if they have a specific respiratory problem, that's where I come in. So they can do some things that we can do, but I can't do a lot of things that they can do. But they are in charge of the patient really for that 12-hour shift. And then we come in and help them with respiratory specific things. Like I said, the education is also different because I graduated with a degree in respiratory care. Nurses, they get a degree in nursing. And when nurses start, a lot of them have a specialty in mind that they want to do, like labor and delivery, ICU, ER, and then they kind of, as they do clinicals and they go in different areas, they decide where they want to go. And so then they can decide to do, different specialties. Whereas when I started school, I'm respiratory. There is no other option, but the options I do have is where to work. I can work in a hospital, I can work in a rehab, I can work with kids, I can work with adults. So there are a lot of options, but it's just within one system of the body. So,
Lily, we have a couple other questions.
Sure.
So this was kind of a double question. How many people do you usually treat every day? And what's the hardest thing you've ever done for someone while you were working?
Okay. So that very much depends on what type of patients I have. So for example, if I am just on a medical floor, so patients who aren't in a very high level of care, they're sick, but they're not the sickest. So you have in range of how sick they are. You have your just floor patients who might be there for a surgery. They might be there, maybe, there's all sorts of different reasons that they could be there, but they're not as sick as your ICU patients. Then you have your intensive care patients. Those are the really sick patients. A lot of times they're on multiple different forms of life support, a ventilator being one of them. So if I'm working with these patients that aren't as sick, I will treat a lot more patients. Like yesterday, I think I had about 20 or so patients. Whereas if I have ICU patients, they need a lot more attention. And so I will have maybe 8 to 10, almost half. But it's because they need my assistance almost the whole 12 hours. And that whole 12 hours, they need me to be available for pretty much anything. So,
Oh, sorry.
yeah. And then the second part was what's the hardest? So definitely one of the overall harder things about my job. It's definitely something I've gotten used to, but it doesn't necessarily get any easier, is that I am, and a lot of people don't realize this, I am the person that takes people off of life support. It is me. So if someone is on a ventilator, a breathing machine, and a family has decided that they are too sick and that they're probably not going to survive, I am literally the one who takes the tube out of their mouth so they can pass away. And that can be really difficult because a lot of times, especially if you've had a patient for a long time, sometimes you have them for like weeks. You get to know the family, you get to know the patient, they'll have pictures in the room of what they used to look like. You learn all sorts of things, and then you have to be the one that takes them off the life support and watch them pass away. And the family, of course, is in there upset, and that can be really difficult. And depending on the situation, it can be really sad because sometimes I've done it to people who are my age or even younger, and that's really hard. So just being honest, but getting to know people is so rewarding. That's not all like that. I mean, there's definitely very fulfilling days that you do, save people and you get to see the good, but that is one of the hard things about what I do.
So we have several more questions.
Okay.
And we're going to try to get to as many of these as we can. And if we can't, we'll see what we can do to maybe get some follow-up to you guys. The next
Yeah.
one was, is it scary helping people and babies who can't breathe?
It can be, yes. Like I said, especially if you are doing all that you can and sometimes what you're doing isn't working and you have to being in a hospital and working with sick people is very much a collaborative effort because I specialize in one area, so I can do so many things, but sometimes you need help from other people. But yeah, it can be scary, especially if you're trying all that you know how to do and it's not working. It can be scary. But when it's so rewarding and so fulfilling when you can use those critical thinking skills and you know what to do on the fly and you're able to fix it, you're like, yeah, I just did that. It's very rewarding when you have someone who comes in, I'm just gonna say basically dead, and you do all of the things and you're like, look what I just did. They're alive because of me, literally. Because I mean, I literally breathe for people. So yeah, it's scary, but in a good way.
Do you get nervous when you work with surgeries?
So I don't particularly work with surgeries themselves. So I don't work in an OR or anything like that. So I usually work with people after they come out of surgery. So they've stayed like with the breathing tube. They're still intubated after surgery. So I don't work with surgeries. But in like if we're intubating a patient, that can be nerve-wracking sometimes depending on how sick they are. So
Okay.
sometimes.
How many days a week do you work?
I typically work 3 days a week and they're 12-hour shifts. That's considered full-time. So that's 36 hours. Normal jobs, 40 hours is considered full-time or 5 days a week. So, but I do 3 days. And it's a good benefit because I get more days off during the week. I do, however, though, I do work weekends. Not every weekend, but some weekends, and I do work some holidays. So, like this last Christmas, I did have to work. So, that is something to consider if you're wanting to work in any type of healthcare, especially in a hospital setting. That's not a big deal for me, but it is for some people. You do sometimes have to work, some Christmases, some Thanksgivings, things like that.
Does it take longer than nursing, or does nursing school take longer than respiratory therapy?
Usually nursing school takes longer. Depends on what type of nursing you want to go into. But a bachelor's in nursing, just a bachelor's degree itself takes longer than a associate's degree. So that's why a lot of people like to do respiratory therapy is because it doesn't take quite as long. But there are respiratory therapists who go to respiratory school and then later end up going into nursing because they want to change it up and they decide they want to get more education. So
Now that you mentioned having to work holidays, do you get breaks at all, or do you take off on any weekends?
yeah. So the way my schedule works is I work 3 days a week and essentially I'm off for 4 days. So I am off more days than I work in all reality. Now, right now it is, flu, COVID, RSV season. And so I'm working a lot more. That's by choice because I want to. But yeah, we don't have to work every single holiday. We get to switch off. So like last year I worked Christmas. This year I shouldn't have to. Usually they switch us every other year. Every place does that a little bit differently. But yeah, but I don't mind it. Usually holidays because they try and send a lot of people home. Usually holidays are pretty relaxed day, and we usually have a lot of food. Everyone likes to bring food and potluck because we're all there on a holiday. So it's really not that bad. I don't mind it.
Lily, are you able to share like a salary range? I know I'm not asking you to share your salary, but just to give an idea of what someone could expect to earn as an RT.
Yes, this very much depends on what state you work in, though, and it depends on what you do. Because there are so many different, I think if you Google it, it's probably going to tell you anywhere from like $20 to $100 an hour. But that's because there's so many different things that you can do within that. So you can work what's called like a travel contract, where you don't work at one place all the time. You work at a place for a short period of time, usually 12 weeks, and there you would be able to make more, but then you'd be bouncing from a different hospital every 12 weeks. So you would have to relearn, that hospital and everything. And, that can be hard, but it's worth it because you can be compensated a little bit higher. Whereas me, I just work at one hospital. I don't travel, so I don't make as much as a traveling therapist would. Something I'd like to do eventually, just not something that's in the cards for me right now.